Do you know the most common cause of adult disability is stroke? Myself Sukumar, I am the student of occupational therapy. Okay, I already said stroke is the most common cause of adult disability and it is the most common cause of dementia. So it is the second most common cause of dementia and second most common cause of death in low income countries, middle income countries and high income countries. We have to take immediate action. If not any action is done, in next decade, in next 10 years, death from stroke over world is increased by 12% and increased by 20% in resource limited countries. And also stroke impacts the quality of life of the person, constitute huge economic cost and give burden to the caregivers, family and society. In most countries, per 1 lakh people, 100 to 300 people are affected by the stroke annually, which means per year 50 million cases are arising from the stroke and two-thirds of the cases are arising from the developing countries. Two-thirds means in 3 parts, 2 parts are arising from the developing countries. Okay, what are all the risk factors for stroke? First risk factor, age. Stroke risk increased by 9% per year for men and 10% per year for women. The risk of ischemic stroke after 55 years is doubled in each successive decades, means 10 years. Okay, by sex, male is more affected than females. By race, black people are 38% affected than the white race people. Then one of the important risk factor, hypertension. If our blood pressure raised into 115 by 75, we are also have the risk for the getting stroke, and the risk doubles when the pressure increased by 20 by 10. So systolic is increased by 20 and our diastolic is increased by 10, then we have the double risks for getting stroke for each 20. If the pressure is increased to 40, then we have 4 times chance for the getting stroke. Okay, this hypertension and our age are not modified by us, but some modifiable risk factors are there. First, smoking, diabetes mellitus, diet and nutrition, which means obesity. So these are all modifiable risk factors. So if we have it, then we have to change our lifestyle to get free of the risk of this stroke, and we have to active our body. Physical activeness should be there for every person, and we have to maintain the body mass index. So it should be 18.5 to 24.9. So that is a normal body mass index. So we should not be underweight or overweight. So we should maintain the body mass index. Other risk factors like coagulopathy, amyloid angiopathy, metastatic brain tumor, these are all the other risk factors. So we have to treat the risk factor. So then we can prevent the stroke. So if the stroke once come, it is give burden to us and our family members. And the prevalence, the morbidity of the stroke is increased nowadays. So we have to reduce the morbidity of the stroke. For this, we have to take immediate steps to avoid the stroke. I believe this video will give information to you. Sorry, already it's given more information to you. Please use it and try to reduce the incidence of stroke in our society. So take a first step by yours. Be proud to watch our video. Thanks for watching. Bye bye.